Welcome to Healthy Dog, Happy Dog. Dog dental care is essential for preserving a dog's general health and preventing oral health issues like infections, gum disease, and tooth decay. Frequent brushing, the provision of suitable chew toys, and arranging regular dental checkups with a veterinarian are all part of proper dental care. In today's video, let us look at periodontal disease in dogs. Your dog's mouth could become infected with periodontitis germs. Typically, this illness creeps up on you invisibly, and you won't notice any major symptoms or indicators until it has progressed. However, gum disease can result in tooth and bone loss, gum erosive disease, and persistent pain. Additionally, the structures that support the teeth may become weak or disappear. When germs and food scraps gather along the gum line and are not removed during routine teeth brushing, they can develop into plaque and harden into the calculus that we know as tartar. This results in gum line discomfort and adjacent areas inflammation. The condition is also referred to as gingivitis. The early stages of gum disease are represented by this. There are some telltale signs of canine periodontitis that pet owners should be aware of, including gums that bleed or are irritated, stained teeth, brown or yellow, missing or loose teeth, poor breath, halitosis, irritability, loss of weight, rookie, or bloody saliva, loss of appetite, one side of the mouth is preferred when chewing, excessive salivation, blood on chew toys, or in the water dish. By the time your dog exhibits signs of advanced periodontitis, he or she may be experiencing severe chronic pain, which causes our pets to naturally separate themselves in order to not attract predators. Periodontal disease affects your dog's mouth, but it can also damage other key organs and result in heart disease because bacteria from the mouth can enter the bloodstream and deposit in the area around the heart. Plaque, which forms when bacteria in your dog's mouth combine with other minerals and become hard in 2 to 3 days, can form over time. The teeth subsequently develop calculus, which becomes harder to remove with a scraper. The immune system will start to combat this bacterial buildup, leading to reactions like swollen gums and more overt symptoms of gum disease. The environment, including grooming practices like how often your dog licks himself, can also have a role in whether your dog develops periodontal disease. Puppy teeth alignment dogs with crowded teeth are more likely to develop gum disease, unclean toys, and oral hygiene. The price of dental operations, such as teeth cleanings, can vary significantly based on your veterinarian's degree of care, your pet's demands, and other elements. Before being put under anesthesia, your pet will need to have blood testing done to make sure she is healthy enough for the drug, which might pose issues for dogs with organ illnesses. Fortunately, we can avoid periodontal disease in our dogs, and if it does develop, it can be treated and reversed if caught early. Don't disregard or put off taking care of your dog's dental health. They need routine dental visits to maintain good oral hygiene and recognize any problems, just like their people. At least once a year, your dog should visit the vet to have her oral health examined. In order to combat dental disease and stop the growth of tartar, there are also dental chews, dog food, and chew toys available. Healthier dogs are happier dogs, so be sure to click the link in the description to get the best chew toys, dog chow, and dental chews. However, a word of caution: don't try to substitute brushing with them, think of them as an addition to normal oral care. Thanks for watching, and take care.